morning, everybody. I'm Dr. Vikas, a consultant pediatric orthopedic surgeon from Kokilab and Dhirubhai Ambani Hospital and Reliance Hospital. So I welcome you all for the pediatric session, which is now began. So today's my topic is development of a normal gait. So a walking child or an individual is a subject for learning orthopedics. In orthopedics, whenever we examine a patient, the examination starts with the gait. So I think the development of a normal gait is very important to know how it develops and how it starts. So I believe that gait is a systematic way to look at a subject walking and define deviations from the normal pattern. So is it even possible to study gait scientifically? Yes, it is, because the normal gait is well defined and it is consistent beyond the age of 7 years. So when a child starts to walk, it's a great achievement. The parents are equally excited. But soon they realize that, is my child actually walking normal? So sometimes the parents, they bring the children to us to examine whether the child is walking normal. So what is called normal in adults may not be sufficient for the child, because here the gait is still evolving. So when they bring the children to us, what we need to understand is whether the child is actually following the normal or typical gait pattern for that appropriate age. So what is termed for the normal for in adults is labeled as a typical for in children. So a lot of preparation goes before the child actually starts walking. So the development of a child always starts from head to toe. So they sit unassisted by about 6 to 8 months. So this is the time when we understand that the spine is adequately stable and the trunk muscles are well developed. They crawl at around 9 to 11 months. So this is the first time they're starting moving from one place to another. And soon they hold on some support and attempts to stand. So this is the time when the anti-gravity muscles of the lower limbs has come into action. And soon later they learn to walk. So but each child is an individual. So some children may not follow all of these stages. But these motor milestones are very important for building the strength in the anti-gravity muscles, which are important for setting up of walking. So normal gait development is a combination of neurological, mechanical, cognitive, and perceptual factors. Though the brain and the CNS plays a vital role in initiation and the control of gait, but the proper joint movements, adequate strength in the muscles, and the normal structure of the bone actually executes a gait. So the central pattern generator, which is located in the brainstem, it actually is a neuronal organization which initiates the gait, and it also controls the firing of muscles during the gait cycle. The descending neural pattern, along with the peripheral modifications, actually executes the locomotion. So the journey of gait actually begins from here. In children, the body proportion is different. They have a large head and upper trunk as compared to the adults. So the center of gravity in children is located in the high level in the chest, just below the armpits. As they grow, develop, the center of gravity shifts down, and at maturity, it fixes just in front of the second body of the sacral vertebra. So for the development of an independent ambulation, postural control and development of anti-gravity muscles is very important. So when the children, by kicking from supine position, they strengthen the anti-gravity muscles of the hip flexors. And from activities in prone position, they strengthen the hip extensor muscles. Both hip and knee extensors are built during the rising from kneeling to standing position. So this is very important for for beginning of the gait. So when every child or a normal child usually starts walking just before or soon after their first birthday. That's the reason why the parents actually, they remember when the child started walking. So during the initial steps, their arms are either widely extended or they're abducted, and the elbows are flexed. they have very little or no movements of the arm swaying movements, which is in coordination with the lower limbs. And like in adults, they do not have a heel strike. They keep the foot flat on the ground, and they take a faster and shorter steps. Both the hips are widely abducted, so that's the reason they have wide base gait for adopting the balance. So just look at this child who just started to walk. It's very excitement, but let me tell you, this is a very unbalanced gait. It's an inefficient gait, but this is a child just starting to learn. So you can see both the arms are abducted and widely extended. And he's taking very small steps, the hips are widely abducted, and he's attempting to have the balance doing the stance phase. So what happens at the age of 18 months? With increased stability, the base support decreases, the hip abduction decreases, the heel strike starts to begin, the knee flexion also comes into action. The limb is located or is able to maintain in one axis and is able to propagate further. So at about 2 to 3 years, they attempt the ability, or they learn the ability to focus their gaze on the ground, and they develop the swaying movements of the upper limbs in coordination with the lower limbs.
Dr. Vikas, I think you are overshooting, so the screen has gone off. So.
Oh, is that so?
You're supposed.
I'm finishing in under 2 minutes.
Yeah.
So I'll skip the video of this 2 to 3 years boy. So at 7 years, usually they fix their gait pattern because the center of gravity shifts to the second sacral vertebra. And this is a stable pattern, and they have a consistent gait like in adults. So everybody knows the normal gait cycle. It has 60% and 40%, 60% stance phase and swing phase 40%. And these are the determinants of the gait: the step length, which is the distance between the 2 feet; cadence is the number of steps taken per minute; and this duration of single limb stance, it implies the increasing stability in the gait. So each gait cycle has a double support and a single support. So these are the 5 major attributes of a normal gait: stability in stance, that is which maintains the balance and avoids prevention of fall; sufficient foot clearance in swing and appropriate preposition of the foot for contact; adequate step length and energy conservation. So our gait is called normal when it has all these major attributes. So thank you so much for your patient listening.